Hi everybody, welcome to another episode of Rice and Beans, where we explain medicine as simple as making rice and beans.
We want to talk about combat sports, we want to talk about traumatic brain injury, and it just so happens
that we have a special guest here from Mayo Clinic. Here, Dr. Steros, so we have a couple of questions for him.
Absolutely.
Thank you for being here and participating with us. So, okay.
it's good. Let's kick it off.
Let's kick it off.
I made a video a couple weeks ago about Adonis Stevenson. He was fighting another boxer named Bostic, and during the fight, he got knocked out. It wasn't anything outside of the norm. It wasn't this huge, brutal knockout that laid him out completely. No, it was a hook combination that put him down. But what was kind of impressive, or not impressive, that's not the word I'm looking for. Well, the difference of his reaction getting up from that knockout was that caught my eye, and that later caught our attention because he had some medical complications due to that knockout that were really important. And I made a little video describing what a subdural hematoma, what traumatic brain injury is. But we're outside of the red area, the danger area, and Adonis is being moved now outside of, he emerged, so to speak, or the sedation, what's the correct word of saying?
Yeah, so
not emerged from the coma.
No, it's not emerged. So basically, the whole process is that, we know that he got the traumatic brain injury, he got the bleed. So what comes next? What does this entail? Well, definitely you need to identify actually what was the initial damage. What's causing the damage, because depending on that, that's how you act. But it's very important in this type of patient where they are depending on many things that are already in our stress levels, like you have adrenaline, high blood pressure. You really need to control all that scenario to optimize and have a good outcome in brain function. So there's a lot of science behind this, so it's very important that once you got a patient with this type of trauma, you rush to the hospital, identify the problem. We do what we call a CT scan of the brain. We see actually grossly what's going on, and we act upon what we see. And of course, we know that he was with what we say altermentation, so we gotta protect his airways. That's why you see these patients being up in a mechanical ventilator with what you guys know and see that they have a tube on their mouth. So it's a lot of things. These patients are extremely dehydrated, extremely stressed due to the fight. So you have to control everything in that aspect. So after that, it's another whole process. You do frequent assessment. What you need to do to the brain, either decompress, take the bleeding out, and
make a little borehole.
Correct.
In there.
Give the whole support. What he said about borehole, literally, is just a little opening that we do in the cranium to evacuate the blood, or sometimes to relieve pressure. We use other techniques, but in that borehole you can actually measure the pressure inside the brain. So it's a procedure that is used for other many things, but basically that's one of, I just want to clarify that because he mentioned it. But then once you have this patient already stabilized, you have to do frequent neurological assessment. They say, hey, he got out from induced coma. What that means? Well, probably they saw a neurological improvement. There's a lot that goes with try to take a patient from the ventilator out, specifically when you have an event that is going to affect your mentation, right? Your function,
mental capacity, your
or
function.
Everything. The brain controls everything, like even breathing, muscle strength. It's what regulates the whole body. So we assess. Fortunately, we heard that he got out of the coma, which is good. Now we know that the good part or the toughest part comes, which is the rehabilitation component. Now what? You prevented more damage in the brain, so what's the next step? And this is why we have here Dr. Starov to kind of tell us what will be the process. And what do you guys do?
So to introduce myself, I'm a doctor of physical medicine and rehabilitation, and specializing in neurologic rehabilitation. And so we see these patients usually right when they're starting to become stabilized, and we look at them and we start the assessment process, starting to talk to them, starting to see where they're at in terms of their confusion level, their alertness, their ability to communicate, their ability to move their limbs, and some basic assessment tasks to see where they're at from their functional standpoint. So we're the doctors that overall look at the person's function and their functional performance and start looking at a plan and how we can maximize the improvement there. So the standard of care, the best way that we have is to once these people are stabilized, like Dr. Medina talked about, the best thing for them is usually to be brought into what's known as an inpatient rehabilitation hospital. So from there, they have a doctor such as myself that's trained with these kind of injuries, as well as a very comprehensive team, physical therapists working on their gait, their balance, occupational therapists which break down the very basic day-to-day tasks. Can this patient now take care of themselves? Can they go to the bathroom okay? Can this person make their own meals? That kind of stuff. Then speech therapy, and it's a multi-hour process over the course of weeks within the hospital setting is usually the best next step for people after such severe injuries.
So what would you say it's a good timetable? So we have Adonis. He had the traumatic brain injury. He was knocked out. Unfortunately, it took a little bit of time until he was taken to the hospital, but now he was taken to the hospital. The trauma was taken care of, right? The neurosurgeon operated, and he was put in a coma. He's outside of the coma. In terms of timetable, when we know this is such a severe traumatic brain injury, how long, ballpark, we're not giving a diagnosis, or we're not,
correct.
But what's a timetable for an individual like this, and how long of a time frame we're looking at until he can have a good,
but what's
good
the average,
recuperation?
basically?
The
Because
average.
so just to clarify, every case is unique.
Right.
It depends on the severity of the damage, and then on the residual functionality, how the patient ended up after that event. So of course those things vary, but sometimes there's an average because you do have frequent traumas of a frequent type, is depending on the situation. So in boxing, it varies as well, but this is one thing to clarify. Mostly is in the sport spectrum, not on family members that have other types of traumatic brain injuries, basically. So because it's a different type of patient,
Yeah.
These patients, they're fit in theory, right? Like they have
Physically
a good
fit.
they have a good functionality. So now we are comparing to a very high performance person to now a residual dysfunction. So that's the challenge part. That is a big transition in the curve, basically.
So how in terms of months or years, what's the average recuperation time?
So again, it is difficult to say because every part of the brain that's damaged, you got to look at how big of a bleed it was,
Extensive. That's
how
important.
extensive it was. But some of the things that we look at to think about how well the person will do, one thing is the age, young person, young brain, and overall overall health beforehand is a big factor. Another one is the actual length of the coma, and what we use is not just the amount of time to someone to be able to open their eyes and communicate, but really the amount of time it takes to follow commands, to which basic question and answering, and how long that takes. Now another big thing that we look at is actually the amount of time that there is a confusional state, where after an injury a person may not be able to make new memories, and so we look at the amount of time it takes for the person to be able to make memories and to remember what just happened during the day.
That's interesting.
And so so we take some of those things into account, as well as any other, did they lose function of an arm or a leg because of the size of the injury, and from there we look into the treatment. So overall the brain recovers, the maximum is usually about 3 months, within the time frame, and even up to years where the person will make the most improvement But that being said, with good care and a diligent team, the person can still recover for a few years and continue to make slow improvements.
That's good. That's good news because every time one of these events happens, the eyes of the public, of course, go to the medical aspect of it. We never think. We enjoy the fights. We pay the pay-per-views, but we never sit down and think about, okay, if there is a brain injury or a bad injury inside of the ring, what's it gonna take to get this athlete? Because we enjoy them in peak performance. So when they're not at peak performance, we think about, okay, this is part of the conversation that needs to take place. Repeated, it needs to be something that's repeated a lot in the media. So hopefully this information will get picked up by a bigger news outlet, and this conversation, a lot of people can hear it and know what it takes to heal this fighter. So was there anything that is there anything important? Let's talk to the staff, to the referees, to the judges, to the fighters themselves. What would you say are a couple of tips of things that we can observe in a fighter that we have to say, okay, maybe there's a more severe brain injury here?
Like a hint, basically.
What do we look for? I'm a ringside physician. I've done over 500 fights, and I always look for gait, the stability of the gait. We see the typical questions. What year is it? But what are the things that we should look for in that fighter that's getting compromised?
So you said some of them, the gait, the ability to follow some commands. So fortunately right now, there's a good amount of standardized tools out there, concussion assessment tools. They're called SCAT, which is standardized concussion assessment tools. There's also tools where for high-level athletes, or as well as high school athletes, what is done often is these athletes are given baseline tests about certain questions, ability to follow multi-step commands, ability to do some calculations, orientation questions, where if there's a situation that there's a concussion or a head injury, that you can immediately say if there's a difference if the person did it. So that would be a very validated method. But given that those initial assessments may not always be done, you do look at, did the person, was there apparent loss of consciousness for any point in time? Again, how is the person able to balance, walk just with one leg in a line in front of each other? How are they able to answer essential questions about, if it's a boxer, what round is it? Where they are, orientation things, and you can do a visual assessment, looking to make sure their eye movements are normal essentially. So those are some of the main ones, I would say.
And that's very important, because during the fight, the bleeding could be evolving already, and it's not till the end that it's already too big or the area too affected. That's where we take action. That's why it's very important what he's saying about trying to really put an eye on the patient, or in this case the fighter, in those scenarios, to see if there's a developing progressive neurological dysfunction, to identify a possibility of a bleed. So,
and there's a question that I get all the time on my social media accounts. A lot of fans have asked, Doctor, actually I did the Adonis Stevenson, the initial video explaining the Adonis Stevenson's trauma, and a couple of fans in the comments asked me, is there any value of doing CT scans yearly? Do you think is there any value on keeping CT scans for every fighter yearly, or would you say it's overkill?
I would say that's most likely overkill. Overall, what the CAT scan of the brain would show is essentially an area of new bleeding, or it could show if there's basically some swelling in the brain. But overall, the best thing is routine clinical assessments by a doctor that knows the patient, by the family member, and if there's a sudden change or a worsening with something going on, at that point it might be a good idea, but it probably would be overkill to do that. Yeah.
So it would be like if there's a fighter and he has a losing record, let's say he's been knocked out 2 times in a row,
Yeah.
then you kind of want to assess imaging. Yeah, that's cool. I can agree with that.
Yeah.
So yeah, we wanted to have this conversation in lieu of the situation with Adonis. We wish him a great speedy recovery. We're covering this, as a social media team very closely because it pertains to sports medicine and lifestyle, which is all what our brand is about. So we wanted to bring you a specialist in the field. So it doesn't get any better than a Mayo Clinic fellow of traumatic brain injury. It doesn't get any better than this. So you heard it from the horse's mouth. Dr. Vasquez, Dr. Medina,
and Dr. Staroff.
Yes.
Dr. Staroff.
Thank you for having me here. Yeah.
Thank you
Sounds
for
legit.
coming.
Thank you.
Bye, guys.